Wave 3 News at 5 starts now.
Well, lung cancer is the most lethal cancer killer in the U.S. But in Health Alert today, new technology may help find that disease earlier, which means cure rates are higher. Our medical reporter Lori Lyle here with that story and good news.
Such a cool new device out there. People with suspected lung cancer and lung disease are traveling great distances to Indiana's Lung Institute at Columbus Regional Hospital. The device is the Cellvizio, and the potential is life-saving.
We have people come from Minnesota and Arizona and South Florida, and it's not a huge volume, but it's certainly the word's out there. If you go to websites and find out who does most of this kind of stuff, we're high on that list. So.
The list using cutting-edge technology to find and treat lung disease. The Lung Institute at Columbus Regional Hospital just added this tiny microscope called the Cellvizio to its arsenal.
And that is the actual end of the breathing tube going right into the lesion.
A lesion inside the lungs of Willie Atwood.
Hard to breathe. Couldn't get out, couldn't walk probably from here 50 feet without being out of breath.
Willie lost his father and brother to lung cancer, a lifelong smoker himself.
I was scared.
Dr. David Wilson says traditionally when an x-ray shows a suspicious area, there are three options: a tissue biopsy,
which is a lot to go through for what ends up about 40% of the time being a benign, non-cancerous nodule,
a needle biopsy with a 30% risk of a lung collapse, or watch and wait. And with that,
yeah, a little dark cloud just following you. And I was glad that he had the tool to work with.
Using the Cellvizio device, Dr. Wilson is able to see the hardest to reach areas of the lungs.
In this case, you see his air sacs are replaced with disease.
An extension of the navigational bronchoscopy that only reaches the main branches, the Cellvizio is pushed to the narrowest parts where disease can hide.
The images of non-small cell lung cancer, the most common form of lung cancer, are very characteristic.
And I remember Dr. Wilson coming in and saying, "Hey, got some good news for you. It's not cancerous."
It's a fungal disease common in the Ohio Valley, treated with medication and, for Willie, a surgery to remove a mass it created.
I'm just thankful to be sitting here today.
Now, Willie quit smoking and is breathing easy these days. For now, the Cellvizio technology is so new that when doctors find tissue that look cancerous, they do still perform biopsies. But so far, for Dr. Wilson, the biopsy has confirmed cancer every time. So they're hoping with this, eventually, they can stop doing those unnecessary biopsies and just get right to the treatment.
Great advancement.
Yeah.
All right. Thank you, Lori.